Welcome to SG Talks. Shagufta is here, your host and your host. I'm thrilled to have a very wonderful guest with us, Dr. Rajul Matkar. She is highly respected obstetrician and gynecologist with the years of experience in women's healthcare. She is also a dedicated woman entrepreneur. Today we'll be diving into her journey and discussing the impact she is making on women's health everywhere. Thank you for joining us today, Dr. Matkar.
Thank you so much, Augusta, for having me here. I'm honored and privileged to be here on your SG Talks.
My pleasure. And let's start with your journey. What inspired you to become obstetrician and gynecologist?
So I was always, as a child, I used to say I wanted to be a doctor because I was very inspired by my father, who was a surgeon. And I think I never said I wanted to be anything else other than a doctor. And when I finally passed my MBBS and it was time to choose the field that I wanted to do, I was really interested in surgery to do exactly what my father was doing. But it was my father who told me at that time that I think you should be doing gynecology because being a woman, it would make a better decision. And I'm glad I just followed that because it was very hard work and years of giving up a lot of myself, but it has brought me to where I really wanted to be, empowering women, making an impact in their lives on a day-to-day basis, which I was doing even in the early part of my practice.
That's good.
So I was really happy to have followed this path.
So you mean to say that your profession is chosen by your parents?
No, they never wanted me to. They never said you must be a doctor. Mm-hmm. I was the one who wanted to be a doctor. In fact, Shagufta, I was not a top level student either.
Okay.
I was a very middle level student.
Uh-huh.
I would score somewhere like a total of 60% or something like that. But when you look at so many years back, I was very focused on the one thing that I wanted to do medicine come what may. And I made sure that after my 10th grade, I went to a science college. I chose that field and then I made sure that I really worked very hard to get the marks I wanted to get into medical college.
That's great to hear. So
I was not academically very, yes, I worked very hard.
You're not so very good, but you are a good child.
Yes.
Yeah.
And then my parents were not, of course, I never knew that my father was very happy that I did medicine. But I didn't know that they never forced us. My mother was also happy that I did it, but it was never forced on us.
That's good. So lots of hard work is there.
There is always a lot of hard work.
There really, yes. What are the key challenges women face when it comes to health awareness?
Okay, so the first thing I'll say is that none of us women really think that we require to give our health importance.
Yes.
That is the biggest challenge. It is our mindset. So we will do everything for our children's health, for our husband's health,
definitely,
for the family, parents, in-laws, everybody. But we don't think our health is that important.
Yes.
We always put it on the back bench unless there's something happening that is unavoidable.
Very serious. Yeah.
Absolutely. So that I think is the biggest challenge. And then not knowing enough. And that is why I do so much of awareness. Because if people don't understand what goes on with their body, they will never understand that they require to address it.
Definitely. So that how this point came into your mind, like I should do awareness, like being a doctor, you should sit in your clinic and you should attend your patients. Instead, you're doing awareness. So what do you made you to do the awareness programs?
Yeah, so Shagufta, I was very in the early part of my practice also when I was in Mumbai. At that time, I was very keen on making awareness about menopause because people were not talking too much about it.
Yeah.
And I realized that, women live much longer now than they used to ever do. And by now, I mean in the last 100 years.
Yes.
Okay, it's not just a recent thing. When you live and you go right up to your 80s and 90s, then you're living nearly half your life with menopause.
Yes.
And there are challenges. In the olden days, people would say, I lived with it, you manage it, you live with it.
Definitely.
No, you can make your life better even if you're menopausal and you have the symptoms. You don't have to live with certain things just because somebody did it 100 years before you.
Yes, definitely.
So I created a lot of awareness for menopause, and I used to talk about that with osteoporosis. I used to even do camps where we used to measure women's, their bone densitometry through small ultrasound machines. And I was doing that, but what really turned around all the awareness for me was when I started talking about nutrition and food and understanding the impact of that in women's health. So when I came to Dubai, I was then even talking about a lot of other things. That was cancer, nutrition, gut health, along with menopause, and of course many more things.
So when you did the first awareness program, how was the response?
In Dubai?
Wherever it was.
No, I've always had an excellent response. People
That's
have
great.
come back and told me, because Shagufta, I've realized that you have to give a lot of yourself to get back in return. And I make sure it's not for show that I do it, neither is it just to get fame. I really want to make people aware of the subject and give them the real facts.
Definitely. And the response shows that there is a need of awareness, right?
Absolutely.
Yes.
There always is.
Yes. How do you tailor your health awareness program for different age groups?
So I really believe that you need to start health awareness right from the time you are a teenager.
Okay.
As a child, a parent will take the child, if it's a newborn or an infant, or as the baby is growing, in their schooling years also, they will make sure all their immunization is done. Even the smallest of cough and cold, you will make sure you will go and see a doctor.
Yes, definitely.
But when the child becomes a teenager, I've noticed that most of the times parents are just grappling with managing their teenage problems rather than looking at their health problems.
Yes.
So I really believe that as a teenager, that's the first thing that you need to continue your health awareness for.
Definitely.
So you need to be able to tell them that they need to come in for regular checkups, do their BMIs. It doesn't seem that important, but it's very important. The way metabolic health has really burst out of the norms at the moment all over the world. If we are not teaching our teenagers to look after their health, especially girls, they go to become the future mothers.
Yes.
And then they have to face problems and in their middle age and menopausal years, because they don't know that they have to look after themselves and put in that habit much earlier.
Definitely.
So we have programs. We don't really have something that's dedicated, but we have programs where I would call in, first of all, boys and girls. We don't want to name it as sex education, but it's basically educating them to know their anatomy and be comfortable with their anatomy and sexuality.
Yes.
You don't want them exploring all this on Google. It's good to make sure that you put the parents together with them and teach them normal things.
Yes.
A lot of parents find it very difficult to talk to their children about this. But just menstrual hygiene, just the comfortable feeling of knowing what is right about your body and what is not right. And answering their questions, because there has to be somebody to answer their questions. It's not about just talking all the time. It's about listening to what they have to say. And that, I think, makes a huge difference to how they will understand how to go forward in their later years.
And where parents cannot do that, you are doing this work.
I would
create
like
awareness.
Absolutely. So when they come in for that kind of counseling, then you may have other problems also. A lot of teenagers may not like it if they are having problems at home
To discuss
it with their parents, or they may not even want to go to a doctor. If you tell them come on for counseling, they're not going to come.
Yes, definitely.
But if you bring them in for one checkup, just for their weight, height, normal things, and then I can initiate a conversation where, everything can be covered. So the first part is in their teenage years, definitely, because you also want to make sure that they're not anemic, that they're not having any vitamin deficiencies. Today, vitamin B12 and vitamin D3 also has such an impact on all other diseases. And you want to be sure that that when they move into the part where they are going to come into their reproductive years, you have looked after these basic things, because you definitely don't want them to go into their reproductive years with anemia, with a thyroid problem that's not recognized.
Definitely.
Okay?
Definitely, yeah.
So those are the things I would catch right earlier on. And I would instill that importance of at least going once a year to see the doctor,
Okay.
which a lot of us women don't have. We think that when we
So
get
overall,
pregnant,
yes.
we need to go to the doctor.
Yes.
We do. Very few women come in for pre-pregnancy counseling to understand what, you want to rule out thalassemia, you want to rule out anemia, you want to rule out a thyroid problem.
Yes.
So it's never too late to come in. And while I'm talking about all this, we don't want to miss out the HPV vaccination that has come much later into the immunization system.
Yes.
And it's to be given to teenagers. It starts at 9 years, but it can be given right up to your 46 years, but in the teens particularly.
Till what age we can?
Up to 46.
Up to 46.
45, 46 years, you can give HPV vaccination.
Great.
But it's more effective when you do it before the first sexual intercourse. So, yes, you must give it. It starts off from 9 years onwards. So, all boys and girls, because HPV is responsible not only for causing cancer cervix, but even penile cancer, even oral cancer. So, we must not let our boys also be not vaccinated.
Yes.
It's very, very important.
Important.
Yes.
So that's really a very great message and good knowledge we got it. How do you balance your career as a doctor and also as an entrepreneur, creating awareness in
So what I really like to do is I like to go for networking events, because I like to be visible. I like to come there and connect. I love meeting people. I love connecting on a one-to-one with people.
That's great.
So that is something that I make time for. I have given up some things in my practice. Initially, I used to really juggle between the practice and doing all of this. But I have now given up some things to balance everything. And yes, some days are really difficult, because there are times when I go and attend events, I go and attend networking and other things, and then directly go into an 8-hour shift at the clinic also. So I've been doing that for many years now, Shagufta. So I think I make time for what I like to do.
That's great. That's great. Really, we have to. And what are the most common health issues women ignore?
Okay, so mainly I feel they don't want to come in for anything that's preventive. So if I said that you need to at least see your gynecologist once a year, get an ultrasound pelvis done, get a pap smear done, get your vaginal discharges sorted. A lot of women think these are normal. Some discharges are normal, some are not. But you don't have the capacity to understand what is what till you come and see your doctor.
That's right. Yeah.
So besides that, you can also come in because you could be having a lot of problems that would affect your mental health also.
Mental health, yes.
So when you come in and you're able to have a conversation with a doctor, I know a lot of doctors don't give women time, and that's why women feel, why should I go? I don't need anything.
Yes.
But the way I look at it, the way I have been practicing, I think and there are a few doctors who also practice like me,
So
I give a lot of time to my patients.
So, have you faced any kind of such patient, you are an obstetrician and gynec, yeah? So, you also deal with such kind of patients who are also weak mentally?
A lot.
Okay.
A lot, because a lot of women in the first place don't have independence. If you're looking at whether it is the ability to speak in the house, or the ability to be financially independent,
Yes.
or the ability to just have a conversation with their family members.
Yes.
And by that I mean the husband as well as the in-laws.
Definitely.
Even if you look at a lot of single unit families living now, they're still very much run by the old, the patriarchal system,
Yes.
basically.
Yes, definitely.
So I think most women find that if they come and they talk to me, it's not like I'm telling them you must become, you must revolt against the system. No, it's not that. It's about the couple understanding how important the woman's voice is also
Important.
in the family.
That's what.
In decisions that are made, joint decisions which are made.
Yes.
So I think sometimes men need to be advised
Understand.
about this and understand it also.
Mm-hmm.
And if we look at our teenage boys and we look at, like, I'm a mother of one son,
Mm-hmm.
I think the responsibility and the onus is on me to teach my son
Yes.
about how he should be
Behaving.
looking at his wife in future,
Really.
which is what I really believe in.
True.
So I think I'm not saying you diminish the importance of parents in life, but it's a very good balance between, you have to have your, why do you call it a life partner?
Yes, definitely.
So I think it's important that our boys learn that too.
Yeah.
Yeah.
So, what are some simple steps women can follow to improve their health?
I think coming in for regular checkups, just routine checkups, is one of the things they need to see. Okay? Whether you go to your GP or you go to your gynecologist, at least once a year, you must go if you have no complaints whatsoever.
Okay.
Okay? Then all the preventive tests that need to be done, you must do, so nothing creeps up on you all of a sudden. Then a diet, making sure that you are taking everything that suits your body.
Healthy diet.
Healthy diet. And by healthy, I feel that each woman, health and healthy defines it separately for each woman.
Yes.
You have to listen to what your body is telling you. Like
That's
what
true.
may work for me may not work for you.
Yes, correct.
So don't generalize any diet tips or don't generalize any of the exercise tips also.
Okay.
So bringing in that understanding that you need to eat certain, superfoods as we call it.
Yes.
So superfoods, maybe I can give you a whole list of superfoods.
Yes.
But what works best for your body,
Body.
depending on what is happening to you, should be identified and you should incorporate it into your,
Yes.
daily diet.
True.
Then exercise is extremely important.
Mm-hmm.
You may not be able to exercise, give dedicated time. I have so many patients who actually turn around and tell me
Yeah.
that we work, I cannot find time for it.
Yes.
But move, keep moving.
Yeah.
So you need to actually move away from the sedentary lifestyle to somewhere where you're moving. So you could walk to work, you could park further away and walk that much distance.
Yeah.
You can climb stairs instead of taking
Like,
the elevator.
How much time exactly? you can
Ideally, if you're walking,
walk? Mhm.
a minimum of 20 minutes and then slowly increase it. Now, if it's a specific thing for losing weight and other things, then it would apply accordingly.
Accordingly,
You
yes.
need to increase it then.
According to your weight, you can.
Yeah. But at least walk for 20 minutes in the morning if you can go for a walk, and then 20 minutes after dinner.
Yes.
Try and eat your dinner early.
Mm-hmm.
Okay? So you don't directly go to sleep immediately on a full stomach.
Yes.
A lot of women also tell me, we are working, we can't have dinner early. No, you can carry food to work.
So, like, of all these things you have told that women can go for such like tests and all.
Yeah.
Like, how we can overcome these things? Like, how we can maintain this our health?
So basically, if you've done the tests and the tests are all right,
Mhm.
and if you're looking after that diet and if you're looking after your exercise, and then I'll add 2 more things to it. You need to reduce stress and you need to sleep well.
Yes.
So if you add that, if you
To
can
our
manage
life.
that,
Mhm.
sleeping is such a thing that today we've lost good sleep because we
Yes.
have our telephones, our mobile phones right next to us.
Yeah.
And I think that is something that is our choice and we can actually put it out of the room. It's a choice we need to make.
That's what.
Just as it's a choice for food, just as it's a choice for exercise.
Mm-hmm.
Also, it's important to know that weight training and resistance training is extremely important because as you grow older and you come, into your middle age and your menopause,
Yes.
you're actually losing your muscle mass. And if you've trained yourself well from the beginning, your muscle mass is what you require in your older age
Yes, definitely.
because you'll rapidly lose it in that time then.
After 30.
after, I would say after 30, you come into the perimenopausal age. A lot of women say, what? At 30? How can I be perimenopausal?
Yeah.
If you're going to be menopausal anywhere between 45 and 55,
So,
nearly 10 years before that, we see perimenopause.
yes.
And we don't realize that these changes are happening. The first hormone that we lose is progesterone. Estrogen is later on.
Yes.
And progesterone loss also causes so many changes in our body.
Yes, mood swings, hormonal
Mood
imbalance,
swings, irregular
overweight,
periods.
Overweight, yeah.
Yeah, everything comes with progesterone loss, which people are not able to understand.
Yes. Even don't know what is estrogen, what is progesterone, yeah.
Yes, people don't even know that.
Yeah. So finally, what message you want to give to our women viewers, like covering overall part, like
So I really feel that you all are unique, all the women, okay?
yes.
And you are unique and your health needs are also unique. So if you make sure that you listen to your body and you make the changes that are required and become aware, that is the most important thing, then I think you can look after your health needs. Supposing you feel you have actually missed out on it in the younger years of your life, it's never too late to start. It's never too late to start changing things whenever you remember that you have to do it. So I think that's the message I would want you to take home, that you're important, you're unique, and you must make yourself important.
Thank you so much, Dr. Rajul. That's really very great to hear from your side. And definitely my viewers will follow the points what you have covered. And it's really very important to take care of your health. Okay, follow all the points said by Dr. Rajul.
Thank you, Shagufta, so much for having me on SG Talks. It's really been a privilege to be over here.
Thank you so much for coming on the show.
Yeah.
And please keep watching with the healthy habits and with healthy eating. See you in next episode.